Sexual assault, to be classified as a public health issue, means that we understand that 1 to 3 women face sexual assault in this country. Not only then 1 to 4 men actually experience sexual assault. It is a situation and an issue that affects everyone in the community. And so when people get sexually assaulted, they need to have the right practitioners to be able to support them through that experience.
There is a national shortage of sexual assault nurse examiners, and that shortage is because training is not available everywhere, and it's not a priority for the healthcare system right now. However, survivors of violence would tell you that we should provide this trauma-informed, compassionate care everywhere.
The STAR program that is based at the University of Wisconsin-Milwaukee was founded for the reason of increasing the number of sexual assault nurse examiners in the state. We found that from previous work that we did that there was a lack of sexual assault nurse examiners that were serving populations of color. In that regard, we create this program to be able to address the cultural specific needs of that population, as well as having a platform for trauma-informed care.
Broadly speaking, the scope of the training that we are doing is to teach nurses how to provide trauma-informed, culturally inclusive healthcare to patients that have experienced sexual violence.
I decided to undergo this SANE training because as a Black nurse and where I do my residency, I find out that there's a need for more nurses to be trained as sexual assault nurse examiners, because especially the minorities, they cannot express themselves when they are sexually assaulted. So I decided that I have to join this program so that I can save my community.
In the SANE training, nurses learn trauma-informed history taking. They learn how to perform a forensic examination, which may include evidence collection, forensic photography. They are also learning the medical management for patients that have experienced sexual assault, in addition to domestic violence and strangulation. But we also teach them about self-care, and I think it's important because nurses who work in this field really experience the darker side of humanity on a pretty consistent basis, and we really want the nurses to understand that it's important to take care of themselves.
Having nurses undergo this SANE training is very important because nurses are the hub of the healthcare. I urge the nurses and the students that they are graduating from UW to take advantage of this program, to do this program before they go and start working so that they can help the community.
The reason why the STAR program is important to collaborate with community agencies is so that we can address the real issues that people face after they experience sexual assault. We believe that those are the agencies that actually understand the population. So we have taken great care to partner with community agencies that are serving these populations.
I feel like this training has made a positive impact in my work and in the community. I work at the Gerald L. Ignatian Health Center in Milwaukee. We're a community clinic. We're actually one-of-a-kind program. Instead of going to a scary, loud ER, they can come to a clinic and they know us there, and it's a peaceful environment, and they can receive the care that they need. There isn't a community-based site like this anywhere else in the country.
For decades now, forensic nurses have been working toward transforming the way that healthcare is delivered to patients that have experienced violence.
This program is embedded within academic environment within the university. We are using evidence-based practice to train nurses, and as we stand here, we have over 60 applicants who need to join the program and go out and provide care. So my hope is that we will have this program continue to be funded, continue to be sustainable so that we can meet the needs of our populations.
I want all nurses to understand that all patients deserve compassionate, patient-focused care. So I'm hoping we're going to increase our curriculum. We'll bring in more students. We'll hopefully precept those students into teaching and grow forensic nursing within the state of Wisconsin and throughout the United States.